Welcome, everybody. This is the Standing Committee on Health and Social Development. Today is Wednesday, January 13th, 2021, 1:30 meeting. Can I get a motion to adopt the agenda? Zach Bell. And with that, we'd like to welcome our new permanent member, Zach Bell, who's replacing the Honorable Minister Jamie Fox. So welcome aboard, and we'll adopt the agenda. And yeah. Today we're going to receive a briefing on the housing registry and housing supports. I'm not sure if there's a presentation or we'll pass it over to you for maybe an opening statement, and then we can open it out after that. So we have Deputy Minister David Keedwell and Director of Housing Sonya Cobb. So welcome our guests, and with that I might just pass it over to you, and then we'll go from there. Or
Well, thank you, Chair, and thank you to the committee for the invitation to come and discuss the housing registry. When we were last here in October, we provided some initial information in relation to the Affordable Housing Development Program, which led to questions in regards to the registry, and we had some takebacks from that session that we provided answers to questions in November. And we understand that the committee has some additional follow-up questions in relation to the information we provided, so we're pleased to be able to come and address those questions for you.
Perfect. Great. Okay, perfect. Great. So at that time, I guess we'll open it up, and it's just a kind of a question period right now. So I'd ask the committee to be ready with their questions. So does anybody want to start? Hannah?
Thank you, Chair, and thank you for joining us again to the guests of the committee. I appreciate you coming back in, and with the information that's provided, it, as I said, did raise some additional questions. I think the first question I would like to have on the record is whether there is a written status report on the department's implementation of the Auditor General's recommendations from the 2017 AG report, which specifically spoke to the seniors housing program.
We don't have a written report for that today. I can give you an update in terms of where we are with that. Each fall, the Auditor General's Office asks us to provide an assessment as to where we believe we are in terms of the implementation of the recommendations. We were asked for that information in November, and we did provide an assessment back to the Auditor General's Office. Our assessment was that all of the recommendations have been implemented, and we are working with the Auditor General's Office to complete their work to determine whether they agree with that assessment.
Hannah?
Thank you, Chair. So there were some very specific recommendations in there relating to issues which I think some of which you've addressed, and some have sort of moved on because it's a significant period of time since that report was done. One of those I'd just like to clarify was around there being, at the time, there were 13 different databases that were being for housing registry activity as per the Auditor General report. In your response back in your November 30 letter, you point in point 6 that the social housing registries maintain in a database. Can you confirm that that is one single database now for the housing registry as per the AG report?
Yes, it is.
Hannah?
Thank you. That's good to hear, because it was definitely an issue that had been identified. The other thing there's a couple other things on the AG report that I'll come back to in a second, but the primary findings from that AG report were about long-term planning. And the Housing Services Division at that time of Family and Human Services identified it, and they did not have a long-term plan. And the key issues that were identified were about that the number of seniors housing units in PEI at that time were insufficient to meet current or future demand, and that the inventory of seniors housing units were aging, with the bulk of them being built before 1980. Has your department had any consultation with any other departments about the need to actually address those concerns, which are about capital investment?
Yes. So in relation to that recommendation for the Auditor General's report, we did go through a process to develop the housing action plan that was released in July of 2018. We have been diligently working to implement the recommendations of that report. We have initiated over 1,000 units up until March of 2019 and are in the process of implementing another 1,200 units to meet the demand that is there for both the seniors housing program and the family housing program. We do work closely with other departments in terms of specifically transportation, infrastructure, and energy around the capital builds that are one aspect of the initiatives that are being undertaken as part of that plan.
Hannah?
Thank you, Chair. I recall we had a conversation when you were here in October about the definition of units. And I will repeat again what I said then, is a rental voucher is not a unit. And while I appreciate that there have been 1,000 plus additional vouchers, supplements added in, they are not inventory. And when we look at your housing registry and how you define housing, it is about an actual physical unit that's available. I do appreciate, obviously, having financial flexibility available through the vouchers and rental systems allows, but the Housing Action Plan was actually about building capacity, and that's what's identified in the AG report, is we do not have enough capacity. And so, you know, my question remains, the long-term, putting vouchers and rental supplements into the system is not a long-term plan. It's a short-term Band-Aid. Is there a long-term plan in your department for the provision of seniors and family housing in conjunction with other departments beyond the provision of rental vouchers and rental supplements?
So I think, I mean, I'm going to disagree a little bit in terms of the people that are receiving mobile rental vouchers. They are currently in units that exist in the market and that are currently meeting their needs. I'm not sure that we would want to go out and take the 1,000 mobile rental vouchers that have been implemented over the last 2 to 3 years and tell everybody in those units that they have to move into a government-built unit. Currently, those people are close to their jobs, they are close to family supports, they are, you know, have their children in schools that are close to where they live and where they choose to live. And, you know, the mobile rental voucher is just one option that we are using to meet the demand for housing and PEI, but I'm not entirely sure that we would be meeting the needs of those people if we ask them to move out of units that currently meet their needs.
Hannah?
Thank you. I think it's quite disingenuous to suggest that I'm telling people that they should not have those vouchers and find somewhere else to go. I think that's really inappropriate. And it's, you know, not at all what I said. What I said was that there's a difference between creating new capacity by building new units and meeting the core housing need of those who are unable to currently meet their core housing need, which is what rental vouchers and rental supplements do. A reminder that core housing need is one of 3 factors. It can either be that the unit that somebody is in does not meet their the need for the number of bedrooms, usually is what it goes by, because of capacity. It's not safe or secure or, you know, up to standard, or they can't afford it. And so as the housing market has significantly changed and quite rapidly in PEI, people who were previously okay in their rental were now, and they're without a change in their income, are not able to afford their housing anymore. And that's what rental vouchers and rental supplements are primarily addressing, is the gap, the growing gap between what people can afford and what's available in the market. The commitment that was, or the thing that was identified specifically in the seniors, the audit of the seniors program by the Auditor General back in 2017, was the need for a long-term plan for seniors housing, development and public reporting of the provision of seniors housing, and the tracking and application of people in that program. The need for seniors housing is growing. And the demographics is not new. We've known for 30 years that we were going to have a seniors challenge, but we haven't invested into the development. So we actually need to do both. And this is the same conversation we had a few months ago. We are not saying in any way, I don't think anyone on the floor would suggest that we'd suddenly take away supports that clearly people need, but it's a short-term solution. We also need to be investing, and that's the long-term planning part. And so, you know, the request for the update on those recommendations is perhaps also the request for the update on the housing plan, which we also haven't received, which we asked for 2 years ago. And there was supposedly a report card from your department on the progress to the Housing Action Plan, and we haven't seen that either. And so it would be great to actually have a thing that doesn't just talk about rental vouchers as new units, but talks about that long-term investment on how many units do we need and how and when are you going to build them? Is there a report that's not just a talking point that says how many rental vouchers there are, but actually what the plan is, when you're going to build and where you're going to build?
So I think I'll go back to the original point one of your points in terms of that there has been no progress report. There has been a progress report in the Housing Action Plan. It was released on February 13th of 2020. We are ready in terms of recognizing that the next report card is due and are in the process of getting that information together, and we would expect that would be released in February as well. We are very diligently working on dealing with the housing registry and making sure that we have options available for people that are on that registry. And we have made a commitment in terms of, through capital builds, mobile rental vouchers, working with our community partners and developers to manage that list by the end of this year. As part of the process, in terms of developing our operational and capital budgets, we are looking at what we will be needing as we go forward.
Hannah?
Thank you. So the follow-up with the Auditor General is this year, it's 2021, that's going to be, they're going to be coming back to you and looking for kind of an update in this year's report. I'm not quite sure what the time frame in the year is, but you're saying you haven't done a written report anywhere else at this point other than internally on the recommendations from the 2017 review of the Seniors Housing Program. Is that correct?
Yes, so they have asked us, every year they ask us to provide that update on our assessment, and we've provided that. They will basically, I'm going to use the word re-audit to determine if they agree with the assessment we've made, and we'll include that report in their Auditor General's report that they release each year.
Yeah. Hannah?
It's only because, there was I think something in both the minister commitment in the House and I think also in writing in a previous correspondence that there was going to be a written response to the AG last November. So I'm just wondering why that's kind of not something that you have available now. Is that the update that you were going to do by November?
I don't think that we've made a written commitment to do a written report. We would report based on the Auditor General's request to us each year, and that response would be included in the Auditor General's report, which it was.
Hannah?
It was in the minister's briefing book, actually. So yeah. Okay, so we don't have anything in writing, but you're telling us you feel confident that those commitments have been met. How are you determining? You've got the layout in here of how you do core housing need. One of the key things in there was that there was no objective criteria on how someone's placement on the list is determined, and I still can see concerns on that. I'm not sure if you're able to speak to it further, but you speak about core housing need, you speak about sort of the income levels, and then the way that they're prioritized, which is income, housing costs, housing situation. But how are you ensuring that there is an objective, reliable process to put people onto the list and then to find them appropriate accommodation based on priority?
So we work on that through our housing officer team. So although an individual housing officer may be responsible for doing the assessment with the client, we then have a supervisory approach in terms of review of that and managerial review of that to ensure, one, that there's fairness, but also that there's a consistency in terms of how each housing officer approaches it. So we do have housing officers across the province, and we would certainly want that, regardless of which housing officer did your assessment, it should come out pretty much the same. So we use that supervisory and managerial review to ensure that that consistency occurs.
Hannah?
Thank you, Chair. And the reason for asking is not in any way any doubt on the capacity or the ability, but it was specifically and clearly identified as a very significant risk and gap in the original auditor report. And it was in the assessment process, it was in the paperwork associated with it. There was basically no way to identify that there was an objective process taking place. And Director, anecdotally, from the constituents that we work with, we are hearing that this is still an ongoing issue. It may be a communications issue, that the criteria and the decision process isn't being clearly explained, but the perception from people in the system is that it is not objective. They're hearing about somebody who got on the list fast or got seen right away. And obviously I understand that there are obviously things that you can't share, and the criteria are very case by case, but there still seems to be an issue, whether it is perception or not, and maybe there is a communications challenge there, that the process is fair. And then that's where, kind of coming back to a single database and a single point of like everything goes in and everything comes out of the same thing becomes really important, because this is obviously critical, but we are hearing quite frequently that the system is not being fair to those who need it. Is there any way that your department can think about ways that we could make that more accessible?
Yes, and we're always looking for ways that we can improve, especially the communication piece. We recognize that when people are applying for social housing, that they're at a point of need, and it's not perhaps the best day that they're having, and even when we think we're being the best to communicate what's going on with the process and what the next steps are, that, they're just worried about their particular situation, and that's what they should be, is worried about their particular situation. So we want to make sure that, we take opportunities to think about that and be sure that we're communicating and that they understand the process, and encourage them that, they get home and they didn't necessarily understand everything, that, please call back and check in with us. Please ask questions. So we're trying to be very mindful of that the communication piece is very important, and everyone doesn't hear all the information the first time, and we don't necessarily present it perfectly the first time or even the second time. So that is a point that's well taken, and that we agree we always have to work on that.
Hannah?
More,
Yeah.
and then perhaps can go to somebody
Sure.
else, if that would work?
Heath, and then, yeah.
Yeah.
Oh,
So you have a range of, we talked a bit about rental vouchers and things and how it expands the capacity. A lot of that is happening with privately owned properties, where that rental voucher or rental supplement is going to a non-government owned landlord or whatever. Can you confirm that that is not considered income for the recipient?
That is, okay, so we do have reporting requirements that we have to follow in relation to the Canada Revenue Agency. There is a reporting process, a T5007 slip that is issued each year. And in the cases of the funding that's going directly to the, for mobile rental vouchers, directly to the tenant, in those cases, that information has to be reported to CRA. It is considered to be income, but is not taxable.
So the vouchers that go to the tenant are non-taxable income?
According to, I perhaps should be referring that to our finance department, who actually deals with that, but that is my understanding.
Chair?
Last question, then we'll move, and then we'll come back.
Yeah, because it's a follow-up to that one, and then perhaps I can come back to it. So the challenge that we're running into, Director, is that we have a number of recipients that are relying on other government programs, for instance, the Seniors Independence Program, who are now ineligible for that because they're in receipt of a rental voucher, because they can't get into government housing, so they're getting the voucher to support the housing where they are, but the Independence Program, they're maxing out on their income. And so it's the same department, but it's two different programs, and the left hand doesn't talk to the right hand, and so we're having this real challenge of people who we've encouraged to stay in their own home, independent, and they're being told that for the first time they're going to have to shovel their own driveway because they have $300 over because they got a rental voucher. Can we address that?
Actually, the right hand of the department did talk to the left hand of the department as recently as last week on that particular issue, and I know that social programs is looking at that in recognition that that was not the intent of the reporting, that that needed to be looked at, so.
Chair, we have, sorry, I know I said, we have, it's coming up over and over. Is there a particular person that we can, or perhaps you could let me know afterwards who I should be referring that to, because we've had 4 more. So there's obviously, it's coming up consistently now, and if we could take that as something to be addressed offline, that would be much appreciated. Thank you.
I know we are discussing it, so it's,
Thank you, Chair.
yeah. The intent wasn't to limit access to other programs.
I appreciate
Yeah.
that, thank you.
Okay, perfect. Thank you, Anna. Heath?
Has there been any increases in your rent supplements or anything of that? Has the percentage changed now that the occupation demand is higher? Has there been any more increases?
In terms of the benefit cap on it, there hasn't been since July of 2019, and the reason for that is that in the prior year, we had increased the caps to a greater degree, recognizing the pressure that was in the market. So we did look at that again when IRAC approved its rate for this January, and we're still in a good range in terms of that cap. So we'll continue to monitor the market and what's going on in it and address that if we need to.
Heath?
Online registry, so that's not public where we can go and find how many people are in the registry in Summerside, Tignish, Cornwall, Surrey, it doesn't matter. That's all strictly confidential within the department.
It's not online, no.
Patient registry where we can go in and access it on a daily basis. So would the department, would this resolve a lot of these questions in relevance to how many people are on the registry, where do those people come from? So when you do make a decision and you say we're building units, and I'll use Cornwall, as that's where I'm from, we're building, why? Because we have 300 people in the registry from that area that could take advantage of these. Would eliminate a lot of questions, no different than the patient registry. So why wouldn't the department take a look at that if it's already been
I have no issue with that. I would think we could move forward if possible to put it on. That's no problem.
you know, I'm assuming you know today, like I think David, your letter was November sometime. I'm assuming you know that is 7:35 today the same number as it was November 27th? And you're likely going to say, no, it's not, it's higher or lower. But it would make, I think it would make, you talk about communication, I think that would be a stepping stone for the public and politicians to understand. How many social housing units are currently vacant in PEI right now?
I don't have that number with me. Anecdotally, there would be very few. There might be pockets where we're between tenants exiting and doing renovations and getting ready for new tenants to come in. So we would consider those vacant, even though there will be somebody moving into that unit. We might have a few units in pockets where the demand just isn't there in that community, but we expect that that will change. But it would be pockets of vacancies.
Heath?
And just curious on the social housing, has any of those individuals been offered any other support, like the rental vouchers or anything like that? Or can they apply for those?
So in terms of social housing, households can apply for either the seniors housing program or the family housing program, and then we work with them to determine what might be the best fit. So we look at all options in terms of whether it's a government-owned unit, whether they're already in a rental situation and they're just facing an affordability issue and they could receive a mobile rental voucher, or whether it would be with a private developer. So they don't have to go through a separate application process. We look at the various options that we have available to meet their need.
Heath?
Sonya, is there a fixed criteria for that type of stuff, or is it just case by case? Like, is there I guess is there something concrete? And I agree with Hannah on those, the CRA stuff when people are saying they're, you know, Minister Hudson's department looks at it and says, well, they're making too much money. And then they can't qualify because they're $500 over, or they base it on last year's tax return when the husband was actually out blowing snow, but this year he can't because he's aging, obviously. But they can't access any, like, you know, I think there's some gray areas there that could be really improved to define who can access these subsidies. And I think sometimes we don't try hard enough, and I was there, I know all about it, so it's not something that, but I think there are some lapses there that could be, and that is definitely one that Hannah brought up that should be really looked at really quickly.
So there is hard criteria in terms of accessing the program. The situation that you noted in terms of perhaps it being based on the prior year's income, that is our starting point. So if your situation has changed, you can come in as an applicant and update that and say, well, now, you know, my spouse isn't earning income, or maybe my spouse has moved to community care or long-term care, and we would change the assessment based on your current income situation, which can either make you eligible, or it may change your level of need, which means you will be assigned a unit sooner.
Heath?
That's certainly good, because I know that people have called me back and said, Heath, I don't qualify, and that's it. So if there's another route there, believe me, you're likely to get some calls on it. And this is a little different. My next question is, there was a contingency fund in the budget of about, I don't know if it was $5 or $6 million. So what was the burn rate on that so far in COVID, or has any been spent on housing?
I don't manage that particular part of the budget for the department. What I can report on in terms of housing is that we did have the temporary rental assistance benefit that supported COVID initiatives, and our main expense over and above that would relate to additional cleaning in our seniors units to help on the prevention side for them.
Heath?
So you've had more of a demand in the rental voucher basically through COVID as opposed to just a normal year? If you're, no.
Sorry.
Yeah, go ahead, Sonya.
We provided a separate benefit altogether in addition to the mobile rental voucher. So this was the temporary rental assistance benefit that related specifically to individuals who had income changes due to COVID issues.
Okay, yeah, Heath, okay. Trish?
Thank you, Chair. So I wanted to ask some questions about point 3 in the notes that you had provided us, the information you provided around access to emergency shelter services, particularly for those outside of the Charlottetown area. So you've listed here some different options that are available. Is this list of options in any particular order, or is it, how do you assess what option a person will be provided with?
So it is dependent on the unique situation that the individual is facing. Diversion to somewhere that's safe for them would always be our first option in terms of, do you really need somewhere tonight? Are you okay tonight? If not, then let's look at the options to get you someplace safe. And if you're okay for tonight, what about tomorrow night? And let's start planning for that. In terms of the other options, we would ideally want to have them in a community of their choice. So if they're from the Summerside area, we would look at motels in the Summerside area. If there's nothing available then we would start moving out into other areas. The key for us is to try to make the match as closely to the person's need.
Trish?
Yeah, thank you, Chair. And I do think that's really important, and it's something that I've heard, you know, from constituents who have had to access emergency shelter, that they had to go to the Charlottetown area to an emergency shelter there because there aren't any in Summerside, or were provided with the motel option, but again, it had to be a motel in Charlottetown. So making sure that we are doing everything we can to keep people in their communities when they are in emergency situations, I think is really critical. And I appreciate that you have listed here access to a motel in the community of their choice. So that would be the community they are connected to, I would think, in most cases. Of course, the reasons for that, are so important in terms of what supports they have in the community, their family and friends, as well as if someone is employed, making sure they can maintain employment. Losing that employment would only make a situation far worse. So what situations then would happen where if there was a space in a motel somewhere in Summerside, which, most of the time, particularly over the winter months, would be the case, are there situations where you would not provide that as the option to someone?
I wouldn't want to say that we would always end up with a person in their community. I don't want to use the word always, but that would certainly be our first choice in terms of keeping them as close as possible to the area that they want to be in. It would be unique to the individual if there was a circumstance that didn't work.
So obviously, having to house people in motels rather than having appropriate emergency shelter services across the island is not ideal. And as was mentioned, we don't have emergency shelter services in Summerside. There has been discussion around a women's emergency shelter in Summerside. So I'm wondering if you can provide any updates on when that might happen, or when that we expect to see that move forward.
So one of the commitments that we did make was to learn more about the level and scope of need in Summerside and in Western PEI in general. We've worked with Canadian Mental Health Association to allocate funding from the Community Housing Fund to actually complete a study in that area so we can best assess what investments do need to be made and how that could best happen. We're in the process of wrapping up that process with Canadian Mental Health, and we expect to see perhaps the report on that in the next maybe 2 to 3 weeks. We have been having conversations with community groups in the Summerside area as well in terms of some options and how they fit with the recommendations that will be in that report. So we are moving forward in terms of gathering more information and looking at what some of the options could be. Certainly more to come in the upcoming weeks.
Thank you, Chair. So has there not been any sort of assessment done to this point in terms of level of need for emergency shelter services outside of the Charlottetown area? Before this, the current report?
There was a global assessment done as part of the community needs assessment for emergency shelter, but we felt that we needed more information to support how best to go forward. So it was worthwhile digging into the Summerside area and West Prince in a little bit more detail.
Trish?
And as part of this study, do you know if current emergency shelter services, such as Blooming House, are being consulted? Speaking with those working in emergency shelter services, I'm hearing from them as well that they are often needing to provide service to those outside of the Charlottetown area and some of the additional challenges that is posing for them. Are they included in this study?
There were a number of community groups that were included in the study. I don't have the list right in front of me. Also, in addition to the work that's being done as part of that study, there is a working group committee that's attached to the Community Outreach Center here in Charlottetown, and those community service providers such as Blooming House, Bedford McDonald House, all of those groups are around that table. So that's another opportunity to collect information about what's going on with their individual organizations and the needs that they're seeing in the community. So there's multiple ways to gather that information.
Trish?
And I'm glad to hear that there are already discussions happening with community groups in Summerside around the opening of a women's shelter. Are there any anticipated timelines for that to happen?
Sorry. We have to complete the process in terms of the study that's been done and review that with the group in detail so that we can support them to develop their business plan and their timelines as to when they could be ready to provide any investments that need to be made. So we're working with them closely, as opposed to us dictating the process that it has to be over the next timeframe.
Trish?
And just a question about that process. So you're speaking with community groups. Is there going to be any sort of an open RFP process or any sort of, because I'm just wondering how you selected which groups you would speak with and if there's anybody being left out of the conversation at this point?
So there were a number of community groups that were consulted as part of the study process. So I think the parties that are around the table and perhaps are closest to the population that needs to be served are at the table and haven't necessarily expressed an interest in providing the service.
Trish?
Sorry, can you just repeat that last part, that they have expressed an interest in, or have not?
They have not.
Okay.
Yeah.
Perfect. Trish?
Just one more question, and then we can move on. There was a temporary closure, it's my understanding, of Deacon House. And I'm just wondering if you could provide an update on that situation, or if we could expect any further closures.
So Deacon House is attached to Health PEI, so I want to be cautious in terms of speaking for them, but my understanding is that it was in relation to a heating issue with their furnace, and we actually provided support through Smith Lodge during the time frame when that repair was being made, and it's been completed and they are open again.
Trish?
That's all for now, thank you, Chair.
Okay. Heath?
I just wanted to come back, Sonya. I'm not sure if I was clear, maybe your answer wasn't clear to me, but maybe it was to you, but relevance to the contingency fund as far as the 5 million, has there been any of that used for any supplements in your department, I guess, through COVID? Or maybe, David, I don't know. Maybe it's something you know, I don't know, but.
I don't believe anything's been used in supplements so far. Again, it's a contingency fund. We're watching what money's being spent. I think to go back to what Sonya mentioned, was most of it at the moment has been used on extra cleaning and precautions at the units themselves.
So very little of the 5 million's likely gone out the door then?
No, I would say, actually, I don't know how it's being tallied right now, but there is how much is being used for the cleaning part would be used against the contingency fund.
Heath?
Has your department looked at the resilience fund, the COVID resilience fund through the federal government to partner on any housing projects or any immediate projects that could be started? I think it's before the December 21.
We're in discussions with Transportation, Infrastructure, and Energy, which is our contact on that, so.
Heath?
No, I'm good, thank you. That's fine.
Okay, perfect. Hannah?
Thank you, Chair. Are renters in receipt of mobile vouchers or supplements still considered to be in core housing need? Are they still, are they still on the registry?
So it depends on what aspects of core housing need were in relation to their file. If affordability was their only issue, then the mobile rental voucher has dealt with that affordability issue, and they would not be on the registry any longer. However, if they had other issues in terms of the number of bedrooms and the state of repair of the unit, then they could continue to look for a unit that met those needs and still receive a mobile rental voucher. So we would continue to work with them on that.
Hannah?
Thank you, Chair. So the mobile rental voucher, even though it's a temporary fix, removes them from the registry. So that means we're committing to that on a long-term basis then. We have to continue to pay that, or else they're going to need to come back on the registry, correct?
That would be the intent, that if they're still eligible for the program, that they could continue to receive that benefit.
So how many households does that represent that are in receipt of the vouchers that are not on the registry?
Currently, we have approximately 1,000 mobile rental vouchers in place.
Hannah?
So that's at a cost of about 11 million a year, is that correct?
Our current budget is around 9.2 million, yes.
Okay, and then the others would remain on the registry because the accommodation is actually not suitable or appropriate, or
Yeah. We would continue to work with them on finding, dealing with the suitability issues and the repair issues, yes.
So does that mean that you're paying funds from the department to keep people in housing which isn't suitable? Is that what you just said?
So because of the fact that we're working on new units, and it takes time for that to happen, we recognized that we wanted to deal with the affordability issue immediately, as opposed to leaving people dealing with affordability issues when we had the opportunity to actually provide the cash and deal with that. So in some cases, yes, they would still be in core housing need because of those other two factors. And as new units come on the market, they'll be able to transition to those, whether they're ones that we own or other ones that are suitable in the market.
Hannah?
What is the line in terms of health, safety, and condition of an apartment or unit where it is no longer suitable? Like, is there a criteria of, a certain amount of mold is okay, or they don't have running water, or, what are the, because those are some things that we hear about. So what is the criteria of and how often are they inspected? Like, how often do we check that the places that are being provided as low-income or social housing are actually fit to live in?
So in the cases in the case where the units are not appropriate, we work with the recipient, the tenant, in terms of their choice around the unit. So if we can support them to find a unit that's a better fit for them and appropriate and in a good state of repair, we will do that. And we will support them as they continue their search to find a unit that is appropriate. We do inspect the units at the assessment stage, because we need to in order to determine if they are in core housing need to begin with because of that particular factor. We also do assessments once a year when we review their income, and we take a look at where they are currently and whether those units are, if they've moved in the meanwhile, they are to advise us of that, and we will update their application based on that.
Hannah?
I'm processing. So we have units that are part of the inventory that are potentially not suitable. And I understand you saying, you'd help them find something else. There isn't anything else. If people are in a unit that they can afford, and part of the affordability is that it's not in good condition, there are vacancies. So I'm really struggling with that, because, the other part of this is we also have under the same remit units that you contract. So for instance, the Queen's Arms, which is, you have a contract with the owner of that building. It's no longer a motel, but you're contracting for sort of short-term housing. And there was a fire there a couple of weeks ago. A man was really badly injured, and he was badly injured partly because he was disabled in a unit which was not accessible, and he couldn't get out. And we're paying for that, but that is not, like, that. There's nothing about that is okay. And I really struggle with how we can on one hand say, rental vouchers are great, and, people are being taken care of, but we're paying to keep people in conditions that aren't suitable for livestock. And, maybe we might be able to fix it next year. It's really frustrating, and it is really distressing, because because somebody doesn't have the means to be able to sort of choose where they want to go, and us telling them, well, this is all we can do for you right now, sorry. Why is this not more urgent? Like we're spending $10 million a year to keep people in poor conditions.
$10 million a year to keep people in poor
$9.2
condition.
million a year in mobile.
The choice, no,
It's $9.2 million a year in rental vouchers that we are spending to keep people housed, which is fantastic. It is fantastic, but it's not fantastic when the house that they're in isn't suitable. And one of the core housing conditions is quality of the accommodation. I mean, Chair, I don't know what else to say about this.
We'll just let David.
If you can respond, that'd be great.
Yeah.
we are working continuously to improve the conditions of the people on the registry. We offer them mobile vouchers. We work with them to find better conditions. As Sonya had mentioned, if it's a poor condition place, we work with them to find a better condition place. A mobile voucher there is immediate for affordability. I don't know the condition of all the units that people are in today, but I do know that we're working diligently every day to make sure that it's better for everybody that's on that registry. And I think it's very wrong to be accused of saying that we're not doing what we're trying to do. We're working every day on it. We've seen the registry come down. We have capital builds. We're working with HDP. We're doing, with private developers, we're doing mobile rental vouchers, all in the sake of helping the people that are on that registry.
Just do a follow-up. So here's a couple of things that I would ask that you could think about doing. You could have an assessment. You should also have as a registry, your registry of all the units and what condition they're in and when they were last inspected and what needs to be done in those. Because if you don't know about the housing and what the current situation, doesn't matter how much mobile vouchers going out the door if we're not looking at the actual quality and the asset inventory of what we have. The other thing is that if you're working with TIE, it would be great if you could actually provide funds to support landlords that have these lower income housing spaces to invest in them, because they can't access some of the renovation funds and things that are out there, and some of these fixes are simple fixes. So it would be really beneficial if we can't build enough housing to keep up with the need, and there isn't anywhere for anybody to go. Let's renovate and improve, because what's happening right now is they're getting knocked down and not replaced, or they're being turned into short-term rentals because it's not cost effective. So assistance to those landlords to actually improve the quality would also be something that could be done right away. So there is more that you could do. And it's not just about mobile vouchers, but it's about recognizing that in the interim, what is the short-term things that we can do to improve what we've got? And if you've got an inventory of 1,000 units out there that you are supporting, that's a pretty significant part of the housing story here. We should probably have some better data on it. How much are people paying in rent? What are we getting for the rent? What's the capacity? What needs to be done there? How can we improve it? So I don't think it's actually that hard. I just think if you're willing to spend that much money on rental vouchers, it'd be great if we could maybe spend some money from some of the other pots in the interim while we're waiting for the builds to happen to fill the gap. So thank you, Chair.
Yeah. Thanks, Ann. That seemed like that was a comment. Did you? No? Perfect. Trish?
Thank you, Chair. So Hannah did just sort of bring forward some of the points that I was going to ask as well, but I guess I want to highlight that I'm hearing two sort of different messages here. So I'm hearing that you're working with renters to do everything you can to make sure that they are in a suitable housing situation, and if they're not, then to move them into a suitable situation, housing situation as soon as possible. But on the other hand, I'm also hearing that there are over 1,000 rental vouchers, some of which are unsuitable. And earlier in this meeting, you said that it would be unfair to expect those individuals to move who are already in those housing situations. So really the expectation is that those rental vouchers are not short-term solutions, but are long-term housing solutions. So those two messages, to me, they don't match up there. They don't align. That doesn't make sense. So I think I'm wondering if you can elaborate a bit more. You've spoken a lot about working with the renter. How do you work with landlords who, in these situations where housing is unsuitable or deemed unsuitable for reasons due to safety, mold, any other circumstance like that? in what way are landlords, held accountable and also supported to make sure that these units, which earlier you said should continue or would be expected to continue in those 1,000 mobile rental vouchers, how are you're working with the renters, I'm hearing that. Are you working with the landlords as well, and how?
So I'm going to back up a half pace there in terms of what sounds like the inconsistent messaging is that not all of those, or even a large number of those 1,000 mobile rental vouchers would have situations where other core housing need criteria are not met. When you're looking at core housing need, by far affordability is the major factor that results in pressure for the tenant. It's looked at each unique circumstance in each tenant. So yes, there are tenants who need to be in other units because of the state of repair of the unit or the size of the unit. But for the most part, we would see that people are in units where it meets their needs, the unit is appropriate, it's close to their school, it's close to their work, it supports them in terms of transportation if they're on a bus line, or even family supports. Their apartment unit is close to their parents' house, which means that their parents can help out with their children. So in those situations where all the needs are being met, we certainly would not want to be building a social housing building that's not close to any of those amenities that support them and ask them to go and move somewhere else. So that it is unique to the individual.
Trish?
Thank you, Chair. So not all of the mobile rental voucher units or units where they're being used are unsuitable, fair enough. Unsuitable is a broad term, so I'm going to just narrow that down to just units that are in a state of disrepair in some way. How many are unsuitable due to state of disrepair?
I wouldn't have that information with me. That's a very specific question that I wouldn't have brought with me today.
Trish?
Is that information you can provide? I think it's a really, really important question.
Yeah, I'd have to go back and check with my staff in terms of how that information is tracked and whether we can provide it specifically.
Trish?
That's all for now, Chair. Thank you.
Perfect, thank you. Brad?
Well, thank you, Chair, and I really want to thank our presenters for coming in today. It's an important topic and a highly contentious one, at least the questions we're hearing here from my colleagues on the Standing Committee. And along the lines of what Trish was asking, I just wanted to clarify a couple things. So the $9.2 million, that covers the full around 1,000 rental vouchers, right? That's the total spend.
That's correct.
Brad?
Unlike what Hannah was saying, not all 1,000 rental vouchers are being used for people that are living in quote unquote unsuitable units. Is that correct?
That's correct.
Yeah, so she was being trying to paint kind of an incorrect picture there, in my opinion, because there's a small number, as Trish was able to find out, of these units that now they're using the term unsuitable. What I want to know is, would you ever allow, and not just you, but the powers that be, ever allow a person to live in an unsafe conditions? Or is that up to the individual, or is that something that we police?
So I would have to say that there would be individuals that are in units that are not what we would recommend that they live in. However, they are competent adults who make the decision in terms of whether that unit is going to meet their needs in the short term while they look for a more appropriate unit. We do understand that because of the low vacancy rate that we've been experiencing, while we wait for new units to be developed, they don't necessarily have a lot of choice, and we certainly would recognize that. We don't want to make it sound that we don't understand that pressure is in the market, but there certainly would be individuals that we would like to see in different units.
Brad?
And so I think, Trish's question was key, So if we have people that are living in these units that, at some level are being deemed as unsuitable. Question is, you know, who actually makes that call? And it's, you know, what does the responsibility of the actual renter have in determining whether it's unsafe for them or unsuitable for them, and how much is the responsibility of government?
So in the case of the mobile rental vouchers, the relationship is between the tenant and the landlord. And they would have to look at their relationship with the landlord in terms of reporting issues, whether those issues have been dealt with, working with IRAC in terms of that, and working with environmental health in terms of that. We provide the funding to them to support the affordability issue, and with the mobile rental voucher, they can take that funding somewhere else to a unit that's more appropriate.
Brad?
So, I mean, is it a fair statement to say that if there's any individual that feels they're in a unit that's unsuitable, you know, that really they feel that's impacting their health, that they have the freedom to choose to make their own decision about whether they stay there or not? Is that a fair statement?
Yes.
Where do they go?
And that's,
Intervention? Brad?
So then the natural question is, if they decide that they don't want to go there, then they have to find a spot to go. Now, the rental vouchers allow them to go to units that they feel are suitable, and then that'll make up the difference, right, with their rent. So we're not at a zero vacancy rate, but just to be very clear here, because there's a lot of allegations, a lot of pictures being painted on the floor. So if I'm living in a unit and I don't want to live there for some reason, and it could be a very, very pertinent reason, you know, maybe because there is, let's say, black mold. If I go and find a spot that's expensive, at what point will, you know, we say we're not giving you a mobile voucher for this, or this is the limit of the amount that we're willing to give you to subsidize your rent?
yeah, so we do have caps that are associated with each bedroom number, and we would provide mobile rental voucher up to that cap, and the applicant would have the option of paying the difference between that cap and the actual rent that is attached to the unit.
So what it sounds like some of my colleagues are saying is that there are people that are being forced to live in conditions they don't want to live in. They don't have any choice but to do that. But how many of, I mean, if they come to the Department of Social Development Housing and they say that, you know, I would assume you keep track of it. Like, how many people would, at least by their own perception, feel that they're in that sort of situation?
I would not have that information with me.
Brad?
Okay, that's fine.
Perfect. Ola?
Thank you, Chair. Last fall, when the House was still sitting, I was surprised to learn that the Minister of Housing wasn't aware that playgrounds, on-site playgrounds, was part of a unit being suitable for if you have children in the family. I was wondering if do you consider playgrounds as part of the suitability needs for your clients with children?
So we would look at what amenities each building that we are supporting through the capital budget needs to provide and meet the needs of the applicants in the social housing registry. Our first goal would be to access infrastructure that's already in the community. So if there's a playground down the street or nearby, then we're not going to put additional playground equipment on our site. So, you know, we'd want to, you know, make best use of existing infrastructure first.
Ola?
Thank you. That is, of course, very well for older children who can go down the street. Doesn't really meet the need of families with young children where you want to keep an eye on them. So with your new units, do they where they're designed for families, do they include on-site facilities for the children?
So in terms of the family builds that are part of our capital budget, we're just starting the design phase on that, so that will be looked at as part of that process.
Ola?
Thank you, Chair. Is there, how big of a proportion of the families that you support do in fact have children?
So in terms of, if I look back at the information we provided in November, at that time, there were 417 households on our family housing registry. Of that, 68% were families. I'm going to say that that doesn't necessarily mean that they have children. It could be a non-senior couple, so that's not an exact number, but kind of gives you a range to start from.
Ola?
Thank you. So the existing family housing you have, do you have a policy of maintaining playgrounds on site, or do you only have or do you just use whatever facilities happen to be down the street?
Most of the existing family units that we have were built prior to 1990, and that wasn't necessarily included in those projects at that time. So we would be accessing infrastructure that exists in the community.
Ola?
Okay. I find that interesting because I was designing several housing units back in those days in the 80s when funding was still available. They invariably included playgrounds, and I think it was even a requirement from CMHC. But anyway, thank you very much.
Great. Thank you very much. Hannah?
Thanks, Chair. You had mentioned around the, with the vouchers, the financial cap that's on that, like the maximum. Can you just sort of go to what that cap is? You know, you have the CNIT kind of income level, the income level from that's set by CMHC. Is that correct?
Yes, so, yeah, in terms of the income threshold, it is set by CMHC based on market survey information.
That's the primary criteria that you use for eligibility for vouchers?
For all our social housing programs.
Right. And so what's the cap work?
So, in terms of the cap for the mobile rental vouchers, on a one-bedroom apartment, it's just under $800. On a two-bedroom, just under $1,000. And on a three-bedroom, just over $1,100.
Can I clarify? That's not how much you pay. That's you pay up so that the rent that is paid up to that amount. So somebody can contribute $547 to their rent. You can, and they want a single person, and then you would bump it up to $800 with the voucher.
It's not quite as simple as that, but yes, that's
The net effect.
Hannah?
Thank you, Chair.
You have to.
Sorry. Yeah. Thank you, Chair. So the net effect is that you're bringing the rent up to that amount by paying the difference between what the person can afford to contribute.
Yes, and it also ties into the what their income is and trying to get that rental amount to 25% of their income, the same as for our other social housing programs. So that factors into it as well.
Hannah?
Thank you, Chair. Yeah, so like for a single person and looking at that income level, then 25% is about $800. So that works about right. But what's the current vacancy rate for the recent? I know the numbers are coming out this week, but we haven't got the report yet. I don't know if you get it early, do you?
If we get it early, we only get it maybe a day early, and we haven't received it yet.
Do you know what the last, Chair, do you know what the last reported vacancy rate was?
That was a low one, around 1.2, 1.3%.
That sounds
Yeah.
right. Thank you, Chair. So 1.3%, then that's literally 1 in 100. Do you know what the current average rental rate for a rental in Charlottetown is?
I don't have that with me. Oh, you have?
One bedroom from 219 from CMHC is just a little less than $800, I think $779 for across PEI.
Hannah?
Thank you, Chair. Unfortunately, we don't have a rental registry. We did say we wanted to get one, and the minister behind me actually thought that was a really good idea, and we voted for it unanimously, in fact, in the House to do one, but we don't have a rental registry, Chair. We do have evidence from the PEI Fight for Affordable Housing about the average rental rates, and the only apartments that you can find for $800 or less in Charlottetown right now are not apartments, again, that I would be comfortable living in if and when they become vacant at a vacancy rate of 1.3. What happens when people's rent is like $1,100 or $1,200 or $1,600 and they're only getting $800 or $1,000 is that they pay more than 30%, and they just have to, right? And so that 30% comes from things, the increase comes from things like food or transportation or, necessities. Has there been any movement from your department on the rental registry? Has that been discussed at all?
In terms of the status and...
Yeah, like that collection of data to help us sort of have a more evidence-based, accurate picture of how much things actually cost and availability and so on.
I'm sorry, could you repeat the question?
Sure. So we had a discussion and then a motion in the House that it would be very valuable to establish a rental registry, which is literally a registry of rental units, and it provides a history. It's obviously pretty under IRAC, to be honest, but it would provide us not only with a history, but it allows us to have accurate data about what is available, how much it costs, the turnover, all of those kind of things that help us make evidence-based decisions. We don't have any of that data right now. So I was wondering whether that has actually come up at all, because it's a bit of the missing picture. It's how we have conversations like somebody's making up things when we don't have kind of data we can put on the table that says this is what we actually know. So has there been any discussion in your department about building that?
The registry is through IRAC, which is not through our department, so there's nothing I can comment on that. If we use a CMHC vacancy rate, which will come out this month, they'll probably also come out with what the average apartment rate is in PEI and in Charlottetown, and we'll use that also as a guide. And we'll use both the vacancy rate and what the average rental part is. So if the rents go up, we'll increase ours accordingly.
Hannah?
And that's great to hear. I mean, obviously we have to use the data we have, and so that new benchmarking would be really helpful, and then support, the lived experience of people in the community who are telling us, some of us apparently, every day that they can't find anywhere to live, they can't find anywhere they can afford, they're paying more than 30%, they're living in things that places that they don't feel are, or that are not, appropriate, and they don't have anywhere to go. In addition to that, there is the real experience of people, but when they're receiving funding from government, it's really difficult to complain. And I appreciate the Deputy Minister's point, absolutely. IRAC has a role, and you mentioned it earlier about, all those things that people can do. There's a big gap between that you can do those things and you actually do them, because that's a really scary thing to do, because you're going to jeopardize your money. If you're getting receipt, and that's the perception, again, that I spoke about earlier, if you're in receipt of government support to afford your apartment and then you go and complain about your apartment, do you really think you're going to get your funding again? We want to make sure that people understand that that's not how it works, but that doesn't mean that's not how people feel. And I think we in this space, we have to be really careful that we do make evidence-based decisions, and it's really hard because a lot of this is anecdotal. So I appreciate you listening to those stories. But I would really appreciate it if when we bring them forward, that we feel that when we get a response back that something is actually changing. Because unfortunately, Director, a lot of these concerns that we do bring forward about the quality of housing or the suitability of housing, a lot of the times the answer is there's nothing we can do and it's not our problem. So some more helpful responses from your team would help us serve our constituents much better, because I don't feel that that is actually a good answer. Thank you, Chair.
Thank you very much. I just have a few questions. In November 27th, I might have missed it today, the number was at 735. What is that currently? Did I miss that?
It's 635 now.
Okay, so it's 635. And can you talk about, were those vouchers that were given to get the numbers down, or was that units?
So it was a mix. If you recall, when we were here in October, we had noted that we were a delay in terms of completing our reassessments.
Yeah.
That would happen, typically, we would aim for having those done on the anniversary date of the application, but we were delayed in terms of doing that, and we had just kind of started the process to get caught up. So some of it's through the reassessment process that should be happening on an annual basis. Some of it's through mobile rental vouchers. Some of it's through new units coming onto the market that we have either, in this case, in that time frame, it would have been in relation to with private builders.
Okay. And does some of it, people's situations change and they just fall off the list?
Yeah, so we would see, especially with seniors perhaps, where they need to move to a different level of care, whether it's community care or long-term care, or in cases where people's circumstances have actually improved and they have more income available to support their housing needs.
I guess I'm just getting a sense of what COVID kind of did during that period. Is it going to be still realistic to get that list to zero by next year?
So it was the seniors list we were talking about, and we're targeting right now to have the strategy to bring that down near zero for those that were currently on it last October.
Yeah, okay. Just a few questions here on, did your department administer the accommodation supports to businesses for the temporary foreign workers?
No.
No, okay. You wouldn't, okay, perfect. I just wanted to check on that. I had a few questions on that. The Queens, can you explain how your department supports units at Queen's Arms, or what involvement the department has with Queen's Arms situation?
So there are a mix of situations, perhaps, in terms of people accessing service at the Queen's Arms. There may be some individuals that, through their own initiative, have units there, and we're not overly involved in that process. But we do have some that we support in terms of it could be providing a mobile rental voucher towards the rent there, and it could also be in relation to other support services, wraparound services that they need to have a successful housing placement. And those services are provided both through Salvation Army and through our housing navigator. So depending on the level of need of the individual, it could be a number of check-ins during the week or on a daily basis. It really is unique to the individual.
Okay. So that just, I'm just trying to get at the point, how do we ask questions about accountability? Is it the Salvation Army's role to monitor out at Queen's Arms, or is it, do they respond back to you, to the department with regular checks?
Yeah, so again, it depends on the circumstance and who is the lead for the particular client. If it's our housing navigator, then they report directly to us. In terms of Salvation Army, they would have a reporting requirement through their agreement with us in terms of statistics and case information and opportunities for improvement and things like that kind of get rolled up to us in terms of their reporting.
And I know that's a newer relationship. There's a good investment there. Are you able to provide any reports? Because once you involve different organizations, it just, I want to make sure that people are looked after and monitored over there. And I've heard that potentially there's been some monitoring problems at that unit, so.
And I mean, that's a good question in terms of, one, a recognition that it's a fairly new service and a fairly new support, and we're learning a lot as we go along. You know, we've tried to be proactive in terms of getting out there and piloting some new services, learning from that, making improvements and continuing on. So that process is still ongoing, and, you know, I certainly appreciate if you're hearing that there's issues there, that, you know, we'll certainly take that back and tie it in with what our staff are hearing and, you know, be mindful of that.
Yeah, and I guess just when you first started to answer the question, as somebody who's trying to ask questions, I wouldn't know how to grasp or formulate an answer. So I'm just accountability, I guess, and stuff is a major thing with that. I'm kind of concerned about. Does anybody have any other questions at this time? Heath?
Just, I know, just on the occupancy, like our vacancy rates that you said 1.2 or 1.5, and I know our turnover rate is really low, especially in Charlottetown. So, you know, to be able to sit here and say that, you know, if you don't like what you have, you can go somewhere else, is not really appropriate, because it's not correct. And no offense, Minister, but, you know, one bedroom is good, David, but 2 bedrooms is coming in around $950 a month. I think since 2019, until the new numbers come out, but.
Yeah.
You know, I just wanted to make that clear that everybody, it's not easy. I'll tell you right now, I've had some young people come to me looking for places to stay. So for this fall for university, and they're looking everywhere and trying to, and it's not easy. So I just, you know, anyway, that's all I had.
Okay. So this committee's okay. I'd like to thank our guests. I know that was you gave us a lot of your time, and we really appreciate it. And it's important for PEI. So, anything else you want to say before we? Okay, perfect. So what we'll do is we'll take a 2-minute recess, and then we'll continue on with our business. Okay. We'll move on to number 4, a discussion of scheduling. The schedule is filling up quickly after last week, and I'd like to thank the clerk for all the hard work that she's done to accommodate. The nurses' union has a conflict. Is there an alternate presentation that we can look at appearing, or an alternate group at this time that you would like to reach out to? I know we had a pretty active work plan, so it's just putting it out there for the committee.
When were they scheduled to come, Chair?
10?
Yeah, I can walk through if you want. So, not all the notices have gone out yet because I'm waiting for some confirmation. But as it stands now, so next week is going to be a briefing from the minister, Dr. Morrison, and I'm sorry, the other name slipped me, on the vaccine, COVID-19 vaccine rollout and safe consumption sites or injection sites. On the 27th, Peers Alliance has agreed to come in. I'm just waiting to hear back from the Charlottetown City Police. They have a little bit of scheduling conflict, but I should know tomorrow and have that agenda or notice out regardless tomorrow. And February 3rd, the minister has agreed to appear, Mr. Aylward, on mobile crisis units. Again, I'm just waiting for some other names, as maybe some guests from Justice might appear as well, in addition to him. And yeah, so that brings us to February 10th, where the nurses union had been proposed on that date, but it's not, they have a conflict with that date, so we'd be looking at a substitution for that time. Another group that the committee might want to see come in before the House sits.
Yeah, perfect. Trish?
Can you just review the other items that we had
Sure.
listed?
Okay, so, well, the review of correspondence, I guess we could.
No, sorry,
Oh,
in the work plan, so we did have some identified areas as sort of next part.
So I believe it was pain management clinics and reducing opioid dependence. And that was kind of tied in with the pharmacists having the ability to change or lower prescriptions that the PEI Pharmacists Association brought up. The Medical Society having them come in to discuss recruitment efforts. It also been discussed, and we have correspondence relating to the social development and housing coming in to discuss core funding for nonprofits. And the Interministerial Women's Secretariat on supporting departments on using the gender-based analysis and reaching diversity targets. And then also the representatives from organizations that represent people with disabilities, so on how the accessibility supports programs are working. I know that's a lot, sorry.
And there's a few things on there about diabetes with a couple of guests that
Yes,
want to
we did
present.
have two requests to present, cystic fibrosis and diabetes, and I apologize, that list is just from what was brought up at the last meeting as additions to the work plan.
Yeah. Trish?
So I believe the two requests, so around diabetes and cystic fibrosis, we had agreed that we would be following up on those requests, so it might be appropriate to prioritize those since they were, that I'm going to suggest that. I don't know how others feel about that.
Brad?
And that's probably fine. I just wonder, what do we have on the work plan right now that's wellness related?
Motion number 1 is on the.
It is, and it kind of just stands as motion number 1 right now. I don't know if we have a whole lot of proposed witnesses to appear on that topic.
I mean, sure.
Brad?
I'm just thinking, we've all talked about it at one time or another about how illness prevention is so key and wellness is so important. I know Chair, that's a passion of yours. It's something I've talked about many times. Maybe we should have something on our work plan that talks about wellness and how we can make progress on that.
Sure.
Or like have people in the talk about what we can do for illness prevention specifically in the province.
Okay. Trish? Yeah.
So just to confirm, so we do have a section on the agenda for new business. So I'm not sure, is it appropriate at this point to be bringing forward new business to be added to the work plan? Because there might be other suggestions as well if we're opening that door.
Yeah, and I think it's, I appreciate the suggestion, and that's another good suggestion. So what we'll do is we might put that towards new business, but we'll bring it up then too. And
I I just wasn't sure if we actually had
Yeah.
some items already on the work plan that were wellness related. Try and bump those up in priority, that's all.
Sure.
But if we don't, then we should, and I'll bring it up in new business for sure. Yes.
Excellent, excellent. So where we left it at, with the two different groups talking about open it to the committee, would that be okay? Or would anybody else, after hearing the clerk's different things that we talked about last week, just open it up to see what everybody would like to do for February 10th?
I'm fine with hearing the two presenters for sure.
Okay. Perfect. Okay, yeah, so we'll do that. We'll send a letter out to both presenters saying that we'll try to bring them in on that day, and,
Both of them on that day?
yeah. Would that be okay?
Yeah,
Yeah.
that's a good way to do it.
Yeah. I should check with you first. Okay, perfect, thank you. So we'll see, and then if, that'd be February 10th. Okay, so that would take care of discussion of, so, review of correspondence would be next on the list, and we had correspondence from Minister Edward about Maple Virtual Care, just seeing if there's any further action there. It was it's a new initiative, and it seems like it was, they had some different statistics, and the uptake isn't really probably where they would want it at this time, but they've had positive. Second letter, does everybody have that? It's January 12th. We received it.
Chair, it's better than we have almost 15,000 people currently without a doctor, and most of them have been invited, but of that, only 2,000 have actually registered.
Yeah, yeah, that's correct. The numbers, the uptake is not there yet. But people are enjoying the service that did participate with it. Trish?
The other question I have, and I'm hopefully I didn't miss this in the letter, but it's my understanding that the current contract with Maple is up in March of this year, I believe. So I see that there's a commitment that an evaluation is currently underway, which is great, but there's going to have to be obviously a decision about what's going to happen with the Maple service moving forward very soon. So taking that into account, I wonder if the committee might send a follow-up letter specifically citing the fact that the contract is to end soon, and what are the plans moving forward, both for the patients, I mean, patients who have registered would need to know, what we just, I don't know if that is a question that others have as well.
I know it's a question that I would have, and if it was a pilot, or what are the fees associated with it, and there's definitely some questions there.
Yeah. Oh, sorry, just one more thing, and
Sure,
the
Trish?
evaluation, if there are timelines on when we might actually see some results from that evaluation that we could have a look at, and, yeah, what are the timelines?
Yeah. And if it's up in March, will there be a gap in service, or are they negotiating contract now, or? Yeah, so great question. So I guess it would be another letter at this time. So we'll put together. Is any other suggestions from the committee to go into that letter? No.
The points that my colleague raised are key, and if we can kind of be, I think the lesson with this is we have to be super specific
Yeah.
about what we want.
Yeah.
Yeah, just on that.
Sure,
Chair,
Zach.
sorry, thank you. The question is going to include as to why there is, only the 2,000 of the 11,000 that was asked. That would be one of the questions specifically.
Yeah.
Okay.
Yeah. Okay. So why such a low uptake, and is there any marketing being done by the province to increase?
And that's to receive written correspondence back again. That's not for not for a briefing.
Yeah, I would written correspondences. I don't know if we have time, so written correspondence at this point. Yeah. So excellent. Perfect. So that's that. And where did my agenda go? And then we're talking about we had a correspondence back from Social Development and Housing regarding core funding, and the letter is there. Dated January 12th. Hannah?
I replied by email earlier today, but probably not in time for people to see it before we came into here. We had asked, the ask was specifically about the commitment in last year's operating budget. It's got nothing to do with the new operating budget. Well, I suppose it could be if it's core funding, but the original ask was actually about the past budget and what's happening with that, because it's a commitment that was made very clearly in the budget and in the House. And so respectfully, Chair, I don't know if it was just misunderstanding or we'll give benefit of the doubt, but I would think we need to go back quite clearly and say, we're talking about a commitment that you have already made and an expenditure that frankly should be spent considering where we are in the fiscal year.
Yeah, okay.
So I would like to ask that as we can perhaps go back with that clarification.
Yeah.
And again, a solid response in writing would be fine, but let's be clear what it is we're talking about.
Okay. Perfect. And that makes sense for sure.
Okay.
Any other discussion with that? Is the clerk okay with that feedback? Okay, great. At this time, we have opened up for new business. Heath, Brad?
Just, he said, hear you.
You're
Oh,
That's all right. Just, we've had some really good discussions in here about mental health and addictions, and I just, sometimes, and including myself, we forget about the addictions to gambling, and I know that the government just signed on to a new gambling product. I'm just, I'd be curious to know, and there hasn't been really much chatter about it, but I've been curious to know if we could bring in public health officer and the provincial addictions coordinator to hear their perspective on a new initiative. And I think it's, it's something we're in the middle of COVID when people are sitting home, and we've seen mental health issues on the rise in pretty near every entity. So I'm just I'm curious about the thoughts behind why they do it now and what effect it may have.
excellent. Excellent. We'll open up for discussion. Trish?
Yeah, I absolutely agree with Heath. I think that this is something that we do need to take a serious look at. I, along with many others, was surprised to see that the decision had already been made by Cabinet to move forward on online gambling through ALC. I would like to also add that, or suggest that we might invite Dr. Jason Doran, sorry. So he's an expert at UPEI on gambling addiction, and I think he would be a very good resource to get some insight into what the impacts might be.
Perfect. Excellent. Excellent. Hannah?
Yeah, I'd like to, my support for this suggestion as well. I think, and I think it's a matter of priority, given that this decision is already underway, Chair. So I don't know whether it's something we can look to as a priority piece. But my thought on it, echoing both my colleagues, but there are many ways that government needs to generate revenue, but they also are responsible for the well-being of islanders, and from a wellness perspective, this doesn't connect in terms of the priority that we've been giving to islanders and islanders, taking care of islanders, and part of government's responsibility is to sort of make ethical decisions as well that are supportive of all. So I think this is the right place for us to have that conversation. I know there's another place where they can have a conversation about it fiscally, but this is a place where we need to talk about it from a wellness perspective. And so I'd really like to express my support for it.
Perfect. Okay. All right. Was that Trish?
Yeah, thanks. And just one more thing I wanted to add to that is that it's not an all or nothing, right? I mean, while this seems to be moving forward, we need to look at, exactly how this is going to move forward. Something that struck me specifically was that the implementation in New Brunswick, first of all, there was no consultation with the public, is my understanding, and that the maximum bet available online was 40 times higher than the in-person VLT machines. So these types of decisions, I think, could quite possibly have a very drastic impact for anyone who's accessing this service, but in particular those who are struggling with gambling addiction. You think about being able to simply push a button on your computer, and that's $100. We need to take seriously how this is implemented, and I really appreciate that we the opportunity to have that in-depth discussion in this
Sure.
committee. I think it's our job to do that.
Sure.
Well, government's job to look into it, but we will do it also, because it has to be done.
Brad?
Thanks, Chair.
Thanks, Trish.
So I do appreciate suggestion about bringing in this Jason Drawn from UPEI to talk about this. I would suggest that perhaps the committee write a letter to the Minister of Finance as well, and just ask, you know, the reasoning behind the move from her perspective, because that's, you know, that's the person responsible. And instead of going to an external source, you should, or not, in addition to going to an external source, it'd be nice to hear from government as well as to what they're thinking. I know there's a lot of online gambling that happens anyway illegally right now. I'm sure that weighed into the decision, so, yeah.
What does the committee think about that suggestion? Is that out of our, that's not out of our purview, is it? Going to finance,
I could ask from a wellness perspective.
from a wellness perspective?
Did you consider wellness when you made this decision?
Yeah, that seems to be a good question.
I am aware that the Public Accounts Committee, I think, is also, so it may be worth
Yeah.
checking with them, but
Yeah.
yeah.
We'll correspond with them,
Yeah,
because,
I don't think who's sitting on that one.
yeah, I was just looking for, thanks for your help there. I'm just trying to think. Heath? Yeah, good.
I was going to say, Chair.
Oh, Brad.
So maybe we should make sure that, that we take into account on this committee the correspondence that the Public Accounts Committee gets then on the question from a wellness perspective, that's all. I just want to make sure that the government voice is heard as
Sure.
well as
Yeah,
external.
absolutely,
That's all.
absolutely. Heath?
Yeah, so I guess I'll make a motion on this, but I just want to make, you know, I think one of these things I think that, and I've been there, so I have a little bit of insight into this, but how you measure the sacrifices that, what equals the benefit to the sacrifices of the mental health side of it and the addiction side was always a real impediment for government. So, but there's been changes to that, and I think there's been awareness now, and they can measure what those are. But I would like to make a motion on
Sure.
this, and I don't know if somebody, Hannah, if you want to.
Okay.
I moved, and I can give you this after if you want, Alicia, but I moved, seconded by Hannah, that we extend an invitation to the Public Health Office, Provincial Addictions Coordinator, and in evidence to Trish's comments, Jason Duran, to hear their perspective on the new initiative to expand at-home gambling and PEI. They could provide further information on the potential adverse effects this could have on islanders, particularly, and I was particularly talking about this during a pandemic, but they'll likely carry it further than that, but.
Sure. Okay, so, did you, well, I think you might have it written down, but, would anybody like to debate the motion? We have a seconder, Hannah's seconding it. Debate on the motion? Okay, perfect. All in favor, say aye. Aye. Nay? Perfect. Passes unanimously.
Just one note, if we're prioritizing this, is this something that the committee wants to take on immediately after the next sitting, or do we want to use that? Okay.
I might just say, I was thinking too, and I don't know what the committee thought, is that we did our work plan last week, we're full. Is it okay, is this priority enough, and we heard that today, that we could look at a slot in the week sometime, maybe a Friday, and get this, if we can get the presenters lined up, can we commit to a Friday to do a special meeting? Would that be okay? Perfect.
I believe now there are some Wednesday mornings open as well, since Poverty no longer meets, but I don't know if that conflicts with anyone else's schedules.
Perfect. Okay.
Yeah, on Friday was usually for rules, but we're only meeting, I think, maybe once. So we could just do work plans.
So we'll keep those two time slots open. Great. It's great to hear from the committee on that. Okay, so we'll do some work on that and we'll get back to you, but it'll be hopefully fairly soon if we can line up the presenters. Brad, you had new business as well?
Yes, so as referenced earlier, just wanted to add something to the agenda.
Sure.
Also related to wellness, this would be a wellness, the previous one we just discussed, but I know, speaking with Minister Elward,
Yeah.
when we were talking about the winter wellness day or bill that he brought forward, we thought, well, this is a great idea behind it. I mean, there's logistical challenges on the education side, but why do it only one day a year? And Minister Aylward had said, well, what about something like a Wellness Wednesday, where it really showcases the wellness activities that are going on around the island, including in our school system, but elsewhere. And so I guess I'm suggesting maybe we get the appropriate people from health and wellness
Yeah.
to talk about what they'd like to see for an ongoing wellness initiative, like a Wellness Wednesday,
Sure.
and just see what they suggest
Yeah.
to the committee that we might be able to recommend to the legislature, and really get this ongoing wellness, get not just school age students, but all islanders thinking about, okay, it's Wednesday, what have I done for wellness this week? What am I going to do? What
Yeah.
can I do? What supports are there, et cetera?
Sure, I think that's a great idea. Open for debate. Trish?
I would suggest that I think it's incredibly important that we do look at wellness and how can we support islanders to live healthy and well. Absolutely. Perhaps I don't know where this idea of the Wellness Wednesday came from, but perhaps a broader look at the topic of wellness and, without sort of narrowing it down to this is what we're going to do, because I would like to hear more about what the plans are, around wellness, what we are doing and what more we could do. I don't want to have a meeting on just one idea, I guess, if possible.
Sure.
Sorry, just trying to clarify.
Oh,
I said, but I'd have them in from the Department of Health and Wellness and talk about ongoing wellness initiatives.
Perfect.
Yeah.
So, would it be okay to send a letter to the Department of Health Promotion at this time to see what their initiatives are, and potentially get them in? Don't know if that would be, or the minister, just send it to maybe just send a letter to the minister?
Minister would be the best, I
Yeah.
think. I think it's the Chief Public Health Office that
Yeah.
often looks after the
Yeah.
wellness initiatives, but probably send it to the minister at this point
Yeah.
would be the best way.
Perfect. So we'll start off with the letter, and then we'll see what correspondence we get, and then thanks a lot for that suggestion. Would that be okay? Yeah. Excellent. Any other new business at this time? Okay, so great meeting. We're clear? Okay, so could I get a motion to adjourn? Brad, Trevor's got it. Okay, meeting is adjourned.